Welcome to our dental diagnosis. This is a case you won't see often. Meet Mr. Kong. This patient walked into my office. He had a set of teeth with one missing. As a dentist, I thought this is simple till I looked at it and I realized that he's been using his tooth that has actually fallen out and sticking it into the soft gum as a denture. And he's been doing that for 3 years. I looked at it and I thought, that should be simple. I see a little abscess there, and I'll treat the tooth next door and I'll put an implant in. And it's again the problem that on this type of x-ray, I could not see the detail. When I scanned him, or when I took a small x-ray, I thought this is simple. The moment that I started looking at how big this lesion is, I realized that this looks a little bit bigger than what I thought. And I stuck him through a scan. The scan showed me this. One massive hole, massive bone destruction, because he's been putting that rotten tooth there in and out every day. So this became a very complex case to reconstruct. What I did with him is I scanned him in 3 dimensions, and now I could see just how big this area was. We planned the implants carefully, we positioned them correctly. I made sure that they're going to be in the correct angles, and then we went through a whole case planning with him, making sure that everything's going to be fine. This was the day that I actually put the implants in. I could see that I've planned the implants properly. I grafted a piece of bone so that he's got function again. And then we went through the whole series of things to try and make sure that this implant is in the correct position. This is what he looked like clinically after the first round. We still had to fix the neighboring teeth. Once the implants were in and we came to the reconstruction phase, I still had to contour gum and do a lot of things to him. We made positioning stents to make sure that we end up in the correct positions. And that was Mr. Kong once we were done. So a complex case. And the important thing is, this only became that complex because the patient avoided going to the dentist for 3 years. So when you have something wrong with a tooth, go see a good dentist. Make sure that what they're going to do is done properly. Else you will suffer for the rest of your life. Make sure it is done correctly.
Your dentist, your choice.